Good morning, everyone. I'm Colleen Bayard. I'm the Director of Regulatory and Clinical Affairs at the Home Care Alliance of Massachusetts. I want to thank everyone for participating in today's town hall conversation on infection control, prevention, and safety in home care during COVID-19. The Home Care Alliance actually partnered with the Betsy Lehman Center to develop resources to help home health workers stay safe during the pandemic. I know you will all enjoy our discussion today. So without further ado, I want to introduce Barbara Fang, the Executive Director of the Betsy Lehman Center. Barbara?
Great, thanks so much, Colleen. So on behalf of the Betsy Lehman Center, I too would like to welcome all of you to this virtual town hall on infection control and safety in home care. So for those of you we haven't met before, the Betsy Lehman Center is a state agency that works to improve the safety of healthcare in all settings across Massachusetts. We all know that, that strong infection control practices are needed to prevent the spread not only of COVID-19, but of many other infectious diseases that are common in home care. We also know that it's not easy. It's not an easy thing to build and sustain knowledge among the home care workforce on how to keep infections under control. So that's why we're excited to partner with the Home Care Alliance of Massachusetts to bring you today's town hall, which is part of a suite of educational tools and resources that we're developing to help you, your clients, and your community stay safe during this pandemic and beyond. So we have a really full hour planned for you. First, we're thrilled to be joined today by Secretary of Elder Affairs Elizabeth Chen, who's going to offer some introductory remarks. We'll then hear from Eileen McHale from the Massachusetts Department of Public Health, who's an expert on infection control. Then after Eileen, Joanne McGinnis from Aberdeen Home Care will speak briefly and introduce a new video we co-produced on the use of PPE in the home care environment. And finally, we'll wrap up the webinar with a Q&A moderated by Colleen that will give you an opportunity to ask any questions you might have. So, but before we get into all of that, we are going to launch a quick poll that we'd like you to take. And so if we can pull up the poll, please just take a moment to answer 2 questions about PPE and the way COVID-19 is impacting your agency's operations. And so you can see there are 2 questions here. The first is, what type of PPE does your agency need the most? And it's a multiple choice question. And then if you don't see the second question, if you scroll down, you'll be able to see the second question, which is, at this time, what is your greatest operational challenge related to COVID-19? So after you've answered both questions, just hit submit and we will share your answers later. As you are doing this, I have a few housekeeping items to go over. So first, if you could take a moment to note where the chat icon is on your screen. I know many of you are quite familiar with Zoom at this point, but for anyone who isn't, you'll find it toward the bottom. You can click this to open up a box where you can type any questions that you might have. You don't have to wait till the Q&A session. In fact, we really encourage you to send your questions and comments anytime you think of them, and we'll come back to them. We will come back to them toward the end of the program. If you run into technical issues, you can send a chat to Megan Carey, who will help you out. And I also want to mention that this meeting is being recorded and your chats will be retained as well. Your video, however, will not be displayed in our recording, but if you have any concerns about recording, just send a chat message to Sam Bissell. Finally, you don't have to worry about remembering all of this now. You can see that everything I just told you is going to be visible on the right-hand side of your screen during the whole town hall. So why don't we show, well, we're looking at the poll results, and in terms of PPE, you can see that there's there are quite a few things and quite a diversity of the kinds of things that that you all need, but N95s or respirators are by far the greatest need. And in terms of the second question, what's the greatest operational challenge? Staffing challenges are the greatest, but there's certainly quite a few other operational challenges that you're all facing. So. So I am now delighted to introduce Dr. Elizabeth Chen, who is the Secretary of the Executive Office of Elder Affairs. Secretary Chen was appointed to her current position by Governor Baker in June of 2019. Prior to taking on that role, Secretary Chen was an assistant commissioner at the Department of Public Health, where she oversaw licensing of healthcare professionals and facilities, as well as the state's determination of need program. And before joining the Baker administration, Secretary Chen served as the president and trustee of the New England College of Optometry and New England Eye Institute, as well as president of 2 biotech companies. So please join me in welcoming Secretary Elizabeth Chen.
Thank you. Thank you very much, Barbara. Thank you for having me here today at your town hall. First, I want to thank the Betsy Lehman Center for producing the videos and convening this town hall. What you are doing today is very, very important. Providing care to individuals at home helps them stay in community much, much longer than if they did not receive this care. And the Executive Office of Elder Affairs funds programming that provides home care to individuals, to 60,000 individuals every year. And 20,000 of those individuals are eligible for institutional care. They're eligible for nursing home care, but because of the work you do in providing care in their homes, they're able to stay at home in a familiar environment and possibly with family and friends that they're not able to do if they were in a nursing home. And so I want to recommend to you that after you watch the videos, that you practice and that you watch each other, find opportunities to watch each other, because it's one thing to do it after after watching the video, but it's another to see it, to really do it on site and to be in the moment and be perhaps under pressure to move from one location to the next. And that's when we see breaks in process and procedures, and that's where infections can happen. And so I ask you to build into your practice an occasional just monitoring each other, just to catch each other, to make sure that we're all using PPE appropriately and all the time. And so I also would recommend an infection preventionist, somebody who can occasionally come in and audit not only your processes and procedures, but also, again, watching and seeing donning and doffing in real time. And I also want to, remind everyone that we have 18 Stop the Spread communities where testing can be accessible and whether or not you feel symptoms. And I would recommend that if people feel that they are at high risk of either contracting the disease or passing it on, to take advantage of the Stop the Spread testing that's available in 18 communities. And every community has multiple locations as well. And also there's Suffolk Downs that has recently opened up. I saw that there is there's a feeling that you don't have enough N95 respirators, and that's definitely true. I mean, that is still a fact across the Commonwealth. But I also want to make sure that you're aware that N95 respirators are indicated only when you're working with somebody who has the disease. So it is protecting the staff member when they have to work in close contact with somebody who has the disease. Otherwise, a surgical mask, a surgical style mask is sufficient. And if both the client and the staff member are masked, it's even better. And so I just want to make sure that you're aware of that. And N95, as I see in the chat, N95s are recommended for aerosol generating procedures. And so in home care, if you are in home health care, you may be helping somebody with a nebulizer, for example, and that would be aerosol generating. But if you're in home care and helping individuals with ADLs, for example, those are not aerosol generating interactions. Before I leave your town hall, I want to again thank the Betsy Lehman Center for inviting me, and thank you, Betsy Lehman Center, Barbara Fang, for putting together the videos and convening the town halls so that we can all be together and address any questions that might be coming up. And if you haven't gotten your flu shot yet, please go and get a flu shot. Okay, back to you, Barbara.
Thanks so much, Secretary Chen, not only for joining us this morning, but for everything you're doing to ensure that the home care workforce is prepared to keep themselves and their clients safe, especially now as we're facing the combined challenges of COVID-19 and seasonal flu. So now I am really excited to turn the program over to Eileen McHale, who is a close friend of the Betsy Lehman Center. She is also the Healthcare Associated Infection Coordinator at the Bureau of Healthcare Safety and Quality at the Massachusetts Department of Public Health. Eileen, as you can imagine, has been quite busy lately, so we're especially grateful to her for being here today to share her expertise with you. So over to you, Eileen.
Thank you very much. Good morning, everybody. And I really appreciate everyone taking the time to be here today. And I really want to thank you all for the work you've been doing throughout this very difficult time that we've been experiencing. What I'm going to talk about today is I'll be talking about some infection prevention best practices when caring for patients who are either confirmed or suspected COVID-19. Next slide, please. So just a little bit of background. I think that probably everybody is aware of this. Coronaviruses are a large family of viruses that can cause illness in animals or humans. And in humans, there are several known coronaviruses that cause respiratory infections that can range from the common cold to more severe diseases such as severe acute respiratory syndrome or SARS, or a Middle East respiratory syndrome, MERS, and now currently COVID-19. I think the important thing to remember about COVID-19 is it's a new virus. There's still a lot that we don't know about this virus. It was first identified in December of 2019. It's caused by the severe acute respiratory syndrome, coronavirus 2, or otherwise known as SARS-CoV-2, causes respiratory illness which can spread from person to person. Next slide, please. So how is it transmitted? It's transmitted primarily through person to person through respiratory droplets, and the majority of the cases have been linked to person transmission. Viral loads have been identified in individuals who are either asymptomatic or pre-symptomatic, and the respiratory droplets have been shown to be propelled up to 2 meters, which is 6 feet. And transmission, we also know that there's some growing evidence that can be transmitted also through the ocular surface of the eyes. Next slide, please. Symptoms. So this is a list of symptoms I think that most people are really familiar with, but I think the important thing too is just think about how things changed from when we first were identified COVID-19. You know, initially the thought was that this was a strictly respiratory and people were presenting with fever, chills, cough, shortness of breath. I think what we've seen over time, you know, we've heard experience that from many that the other symptoms, you know, so many of these other symptoms that you see on this list, if your patients experience those would indicate, you know, need to have testing done. So some of the symptoms have changed for, you know, new loss of smell or taste, nausea or vomiting or diarrhea. The incubation period is estimated to be between 2 to 14 days with a median of 5 days. And again, important to note that that some people become infected and do not develop any symptoms or feel unwell at all. Next slide, please. Severity of illness, again, it's variable. We've seen, you know, I think there's a lot of mild cases that we're seeing from in the community in particular, and most of these patients do recover. However, there are people at higher risk for severe illness that can cause death. And unfortunately, we've seen quite a bit of that. We've seen that this severe illness seems to increase with age, and those of all ages with, you know, underlying medical conditions appear to be at the higher risk in developing severe COVID-19. Some examples, and this is not an exclusive list, you know, they can include heart disease, diabetes, or lung disease. And I think that we've had some, you know, we've seen worldwide, you know, it's been devastating here in the United States. According to the CDC, there have been 9 million cases with 230,000 deaths. Massachusetts, we've also seen severe mortality and morbidity, more than 150,000 cases with approximately 9,800 associated deaths. Next slide, please. So I'm just going to move into, you know, what are those recommended routine infection prevention and control practices that must be implemented in order to care for our vulnerable residents who may be suspected of either they're suspected or they have COVID. So I think some of the things have been implemented already in healthcare settings. I'm sure these are underway in the home health agencies. Move to, you know, implement telehealth and nurse-directed triage protocols, something that's been recommended. Screening and triaging everyone entering healthcare facilities for signs and symptoms of COVID-19. In the setting of home care, that, you know, the staff there should be some protocols and procedures in place for staff to screen themselves before they enter or conduct a home visit. You know, monitoring their sense of illness. If they're not well, they should be reporting to somebody that they're not going to be going to work, should not be entering a home. In addition, for the staff to be screened, also clients and families should also be part of your screening prior to those home visits. And I'm sure there are many, I'm seeing a question. Screening of clients and families prior to the home visit, and that communication, you know, should happen, you know, before the scheduled visit, either by phone, text message, video conference, and the same screening that is required for staff should be done for those in the home as well. Routine infection prevention and control, you know, universal source control, that, you know, the patients that you're visiting in their homes, they should be masked if possible, if they can tolerate during the visit. Physical distancing is certainly one of the standard measures that we have in place currently, maintaining when possible at least 6 feet, and application of standard precautions for all patients at all times. And universal implementation of PPE, personal protective equipment. Next slide, please. So standard precautions, what are standard precautions? They are they're precautions that are used for all patient care, and they're really based on the level of risk, and they make use of common sense practices and personal protective equipment use that protect the healthcare providers from infection and prevent the spread of infection from patient to patient. I think that's really important that this, you know, people understand that the use of PPE is to protect the healthcare provider. What are standard precautions? They entail hand hygiene, and the hand hygiene using alcohol-based hand rub or soap and water. alcohol-based hand rub is preferred over soap and water when possible. Standard precautions also include respiratory hygiene, cough etiquette, coughing and sneezing, making sure that people are, they have the appropriate tissues. There's a receptacle for disposal and so on and so forth. Another part of standard precautions are safe injection practices. Using engineering controls, safety syringes should be used. Safe injection practices also require appropriate disposal. Management of sterile instruments or devices, cleaning, that would include, cleaning and disinfection of those instruments that may be used. Cleaning and disinfection of the environmental services is also part of standard precautions, and the use of PPE. Next slide, please. So I'm going to shift a little bit here and talk a little bit about what's the recommended PPE when caring for a patient with suspected or confirmed COVID-19. So the recommendations are respirator or face mask. And important to remember, I think in particular in the setting of home care, that a cloth face covering is not considered PPE. N95 respirators or a respirator that offers a higher level of protection should be used instead of a face mask when performing or present for an aerosol generating procedure. And I think in most cases in home care, those types of aerosol generating procedures are likely not happening, with the exception of nebulizers. And I think that, people who are able to, make the transition from use of a nebulizer to like a MDI with a spacer, that's really recommendation. Eye protection is recommended when caring for a patient with suspected or confirmed COVID. And that eye protection is either a goggles or a face shield. And just really important to remember that, the face shield needs to cover the front and sides of the face. And goggles also, they should come around the side of your face. There should be no gaps, no holes. And also important for people to remember that glasses are not eye protection. So you need to have something more than just your own eyeglasses. Additionally, gloves, clean, non-sterile gloves are recommended, PPE when caring for patients suspected or confirmed with COVID. And important to stress with, in education that, the use of gloves does not negate the need for performing hand hygiene, before donning the gloves and then once they're removed as well. Gowns, disposable gowns should be discarded after use. If cloth gowns are used, they should be laundered after each use. Next slide. And this is just a schematic that I think probably people you've likely familiar with this. This is developed by the Centers for Disease Control. And you can see on the left-hand side of your screen, it identifies the preferred PPE, and that's the use of N95 or higher when caring for COVID patients. And you can see what the face shield looks like here. It sort of wraps around the user's face, and that's really important that it does do that. One pair of gloves, non-sterile gloves, and an isolation gown. Some of the things that we've been seeing in some settings of care is we've seen people using double gloving, and just as a reminder that it's not a recommendation to wear two pairs of gloves. The right-hand side of your screen, you can see this is the acceptable PPE. As Dr. Chen had mentioned that, N95s, we still have shortages of N95s. And so those N95s, if it's not available, or then a face mask is an alternative that can be used. Next slide, please. I think Dr. Chen touched on this as well. It's really, really important. I think that in terms of talking about PPE, people that many, there's throughout the pandemic, we've seen that there are many people who had previously not necessarily required the use of PPE have now been required to wear this in healthcare settings, including home care. It's important that before people begin to care for patients with COVID or confirmed or suspected, that they receive training. And that should be, comprehensive training on, when is it necessary, how to don and doff. And I think most of us know that the area where the, self-inoculation or contamination of the user happens in the doffing procedure. So it's really important that people have comprehensive training. understand the limitations of their PPE and, what is the proper care of it, maintaining it, and how should it be disposed. Before, they are, people wear PPE, they should also demonstrate competency. So I think, training. So somebody actually watches somebody donning and doffing the appropriate PPE, giving them tips. If they're touching something that they shouldn't or doing it inappropriately, that they're, can cue them on the appropriate use. And I think the other thing is, more difficult perhaps in the setting of home care, but, really to make sure that people are actually adhering to the best practice, doing some audits, maybe watching people do it and using the data, sharing the information back to drive improvement. Next slide, please. So I just was thinking a little bit about home health, and I think that this is probably, you're well underway caring for residents in the homes, and thinking about, the infection control issues related to going into home care. It's very complicated. It's different than being in a, in a healthcare setting and a long-term care facility in a hospital where, you have the supplies readily available. If you in fact had, didn't have something, you were missing something, then you could go to a particular place within the healthcare facility and get, say, a gown if you forgot to bring that to the point of care. More difficult, more challenging in home healthcare. People, I'm sure, have to be really, really organized. Some of the things I would think that you would be very cognizant of is making sure you bring in only the necessary supplies, equipment, and materials. Because if you bring additional, extra things into somebody's home, if the person is COVID positive or suspected to be COVID positive, some of those materials, like say an extra gown, you wouldn't take to the next home. Also thinking about when the care that's provided, if you're doing a dressing change, making sure that you have things such as a barrier, putting some sort of a barrier, a chuck or something to place your equipment on and dispose of that prior to leaving the home. Again, would highly recommend disposable equipment if available, and leaving the computer, not bringing the computer into the home, and, maybe doing your charting after your visit. And I think I just saw something in the chat. It sounded like people put it in a plastic bag, bringing it into the home. So just making sure that bag would be cleaned and disinfected before it left the home. And this is probably difficult too, when you're performing your direct care, limiting the contact as much as possible with the participant or other individuals. This is a setting where people are in their home. It's harder, I think, to maintain those, 6 feet of, distance, and make, constant reminders for people to do that, and avoiding direct contact, maintaining those 6 feet. And, I really appreciate the difficulty that you probably have, doing the work that you need to do in a limited amount of time, but still having the need to be connecting with those folks that you're seeing in homes too. So I appreciate all of the work that you are doing. Next slide, or I think I'll stop there.
Great. Thank you so much, Eileen. And if we were in a big room with 65 people in it, I'd ask everyone to give you a round of applause.
Oh.
Thanks so much for taking the time to be with us today. Before I hand it off to Joanne to run through the PPE video, I just want to encourage everyone to use the chat box, as some of you have, to begin to ask questions, because Eileen will stay with us through the end of the webinar and through the Q&A process, and Colleen will moderate that. So I want to encourage you to do that. And it's my pleasure also now to hand this program over to Joanne McGinnis from Aberdeen Home Care. Joanne helped us produce the PPE video. She helped find the actor and also did a lot of the direction. So Joanne, take it away.
Great, thanks so much, Lisa. So I think it's important, before we preview the video, which some of you have undoubtedly seen, is just to remember that we had a focus on what this video was to accomplish. And in the many meetings that we had since its actual production, there have been a lot of really helpful feedbacks offered by people who have previewed it about things that we might tighten up or modify to make it as accurate as possible. In the late spring and the early summer, we were getting a lot of different information, as were the caregivers in their regular lives, about whether masks were even useful. And so to get that information and then be told by their employer, no, they're mandatory, it really gave them a sense of confusion, I think. And so staying consistent with our messaging all across the Commonwealth, no matter what kind of care we're providing, but that no, this is really what is needed for your protection and the protection of your client or patient or resident. The intention of the video was to show a very slow and deliberate technique. And it seemed to me like it was moving at a snail's pace. I was there for the whole filming of the video. But when I looked at it afterward, I realized it does need to be slow and deliberate to really be a valuable educational tool. And then we had to keep going back to what is the main focus? The main focus is that people become familiar with looking at these PPE pieces and preventing cross-contamination. Doffing, as Eileen pointed out, is much more critical than the donning. When you're donning, you're putting everything on that's clean. But when you're doffing with a COVID positive patient who might be taking a respiratory treatment on a nebulizer, your outer layer is possible to contaminate yourself. And so going through how do we take off the gown and roll it up inside out and dispose of it was of paramount importance. We looked at a lot of videos that had been produced around the country before we undertook the script writing and then the very careful production of the video. And we saw a lot of things that were, kind of alarming, especially in home care, where you see a caregiver go to the back of a hatchback car and open up their trunk and start putting the stuff on in a driveway. They don't have the beauty of a spotter like you do in the hospital. They don't have, in-person instruction. So something that they could refer to on their iPhone or on their smartphone to walk them through how to do this and refresh seemed of extreme importance, hence the video. And again, just to say that the relaxed societal instruction about mask or no mask and how protected we need to be, the caregivers are hearing that at home and on the news and with their family and around a fire pit. They're hearing all this information from different opinions. So it was really important for us to come out with a consistent message that was firm and science-based and with a lot of confidence that this was essential in preventing the spread of COVID-19. So as you watch it, you may see things that your agency does differently, of course. And as you share this video with your people, make sure that you can customize it to whatever your agency does. But remember, it was a global initiative to cover the main points of a generic donning and doffing process for home care people out in the field who don't have the privilege of being able to be suited up by someone in a hospital. I hope you enjoy it. I think it's very well done. And thanks very much.
Stay safe. This is your guide to Stay safe. This is your guide to wearing personal protective equipment. As a member of the home care team, you play a valuable role. Taking steps to keep yourself and others around you safe and healthy is really important. There are many kinds of viruses and other germs in the home care settings where you work, and you can't always tell when people are sick. Even people who look or feel well can be contagious, exposing others to infection. Wearing personal protective equipment, or PPE, is essential to protect yourself, your clients or consumers, and your family and friends from COVID-19, influenza, strep, and other diseases. Knowing how to put on and remove PPE correctly is the best way to prevent viruses and other germs from infecting you or the people you come in contact with. The good news is, putting on and removing protective gear is not difficult. Following some important steps each and every time will help ensure you get it right. You can do this. So let's get started. This is Miria. She'll show us how it's done. First, let's review the protective gear you may need to have with you when visiting a client or your consumer employer. Depending on the situation, you may not need to wear every piece of PPE we're about to show you. Your supervisor or consumer employer will tell you what types of PPE to wear. Generally speaking, it may include some or all of the following items: a disposable gown or jumpsuit, to cover your body and arms. Make sure this is the correct size for you. A face mask or a respirator, either a face shield or goggles, coverings for your head and or your shoes, and gloves. In addition to your protective gear, you'll need hand sanitizer when putting on and taking off your PPE. It's a good idea to have clean trash bags on hand for disposing of your PPE after use. Let's review a best practice for putting on or donning your PPE. Make sure you put on your protective gear before you enter the client or consumer's home, or if in a care facility, before you enter their room. Set up your trash bag now, so you'll be ready to dispose of your PPE later. If you didn't leave your jewelry at home, remove it now so it won't tear your gloves. Remember that good hand hygiene includes keeping fingernails closely trimmed and not wearing artificial nails. Start by cleaning your hands thoroughly with sanitizer. Squeeze a generous amount of sanitizer in your hand, about the size of a quarter. Rub your hands together vigorously for at least 20 seconds until your hands feel dry. Singing happy birthday twice is one way to make sure you're taking the full 20 seconds. It may seem like a long time, but it's necessary to make sure you're eliminating germs that could make people sick. Next, put on the gown or jumpsuit if you are using one. For the gown, place your arms through first. Then secure all the ties. Make sure the gown covers you from your neck to your knees, as well as your back. If using a head covering, put that on now. Make sure to tuck your hair completely under the head covering. Now, you're ready to put on a clean face mask or respirator. There are several different styles of face mask. You will use what your supervisor or your consumer employer has supplied for you. Place the face mask over your nose and mouth and secure the elastics around your ears. Make sure the mask covers your nose and extends below your chin. If it has a flexible band for your nose, gently press to fit this to your face. If using a respirator, put it on as you were instructed when you were fitted for the respirator. If you are using eye protection, put that on next. For goggles, make sure they provide good coverage around your eyes. If using a face shield, it should cover your entire face. Put shoe coverings on next if you're using them. We're almost done. But before you put on your gloves, clean your hands again for 20 seconds. Finally, put on your gloves. Pull the gloves up fully until they cover the wrists of your gown. That's it. You're now ready to enter the home or room. Now, let's review a best practice for safely taking off or doffing your PPE. This should be done outside the residence. Start by removing your gloves. It's important to do this in a way that avoids contact of your skin with the outside of the glove to prevent viruses or other germs from getting on your hands. Pinch the outside of the glove near your wrist. Peel the glove downwards, pulling the glove inside out. With your ungloved hand, slide a finger under the wrist of the other glove. Again, pull downwards, turning the glove inside out. Then dispose of the gloves. If you're wearing a jumpsuit or gown, remove it next. For the gown, start by undoing the ties at the neck and back. Then reach up to your shoulders and carefully pull the gown down and away from your body. Touch only the inside surface. Roll the gown up tightly, then dispose of it. At this point, clean your hands again for 20 seconds. If using a face shield or goggles, remove that next. For the face shield, carefully grab the strap and pull upwards and away from your head. Avoid touching the front of the face shield or goggles. You will need to disinfect these before your next appointment. If you're wearing a head covering, remove it now. If you will be cleaning and reusing it, place it in a separate bag. If wearing shoe coverings, remove them now. Clean your hands again for 20 seconds. Next, remove your face mask or respirator. Unhook the elastics from your ears and carefully pull the mask or respirator away from your face. Make sure not to touch the front of the mask. Dispose of the mask, or if you will be reusing it, place it in a separate bag. Finally, clean your hands once again for 20 seconds. You're now ready to move on to your next client. We've shown you the basics. Now it's up to you. Practice putting on and removing your PPE to get familiar with doing it properly. Take your time when putting PPE on and taking it off. Don't take shortcuts. And remember to change your gloves and wash your hands as frequently as you need to during your visit. Doing this correctly each and every time means you won't pass viruses and other germs to others, including your family and friends. After all, keeping people safe and healthy is what it's all about, right? Remember, your community is counting on you. You got this. You can find more information online. Thanks for watching.
So hello, everyone. This is Colleen Bayard, and I hope you enjoyed that video. A lot of work and time went into it, as Joanne was saying, and I hope it's useful for you. The Home Care Alliance actually will have a PowerPoint that you'll be able to use. We have a pre and post test, so if you want to use this for educational purposes for your clinical staff, you can do that, and then we'll give you the other documents that you will need to make it a little bit easier for you. So while we have Eileen McHale from the Infection Control Coordinator from the Department of Public Health, I'd like to review some of the questions. And while she's here with us and giving us her time, please feel free to chat in more questions. Okay, let's see. So I think this was just a comment, but it was to share as well. N95 masks are also recommended for aerosol generating procedures, and including chest therapy and CPR. So I know that was, and people have had a question for me as well, what to do in the case of CPR.
So I'll follow up after the meeting with, we recently had this question came to the department as well. If you're a single person in a home where there's a situation that you have to respond to. So it's the American Heart Association has recently updated the guidelines for that. And I'll send and we talked with our colleagues in the Office of Emergency Services, and I'll share that with you after this, so that you can send out to people. It describes, what to do in a particular situation. If somebody does not have the appropriate PPE, I think the long story short is that your recommendation would really be to, call 911 immediately and start compressions. But I'll send you the link that'll provide the rationale for that.
Oh, that's wonderful. Thank you. The next question is, with lists of various symptoms and many asymptomatic, if a caregiver notifies us that they have a runny nose, mild congestion, no fever, do you recommend they be pulled off care until screened?
I think I would strongly recommend that they be, they be tested to ensure, that they don't have COVID. And I think at this time of year, we're seeing lots of, respiratory illnesses. Flu is something of concern as well. But I think somebody with those, describing those symptoms that, as you saw the symptoms on the slide that I showed, their symptoms can be mild. It can be like that. So I would recommend, pulling them off care. It's hard for me to make that decision. I suppose it would matter, depends on, what is the reason for the visit. Is it essential? Is it, would it be highly detrimental to the patient not to have a visit? I think that's something would have to be made by the home health agency, but I would recommend that person be, be tested. That, those are the signs, symptoms for testing. I don't think the home health staff is actually doing the testing in the home, but as Dr. Chen had mentioned, there are multiple places that, where testing can happen, and would strongly recommend this person be tested.
Okay, great, thank you. I think this is more of a comment and to share with the audience. Our policy for patients who can self-administer neb treatments is that our staff do not enter the area for 3 hours. If they have entered within 3 hours, full PPE and an N95 are required.
So I think, again, I would, nebulizers are probably, it's the aerosolization actually happens with the neb itself, but I think that, that certainly is very conservative, 3 hours, but, again, suggesting that could this person be switched from a nebulizer to MDI, any other, another, to prevent it being an aerosolizing procedure.
The next question, I think you already addressed it, but our staff put their tablets in a Ziploc bag for infection control. And I believe, you said it still has to be wiped down when they leave the home.
I'm sorry, Colleen, I didn't quite hear you. Could you repeat?
Yeah. So our staff need to put their tablet, their computer, in a Ziploc bag for infection control.
Yes. So then that would be another another thing that they'll need to clean and disinfect. They have a tablet, they use the tablet, put it back in the bag. The outside of that bag should be clean and disinfected. I see a question. What's the next question? So talking about cleaning and disinfection, which I didn't mention that. It's really important that people use what's on the EPA, the Environmental Protection Agency, they maintain a list of those products that are effective against SARS-CoV-19, and people, when they're making the selection of what to use for cleaning disinfection, for example, the pulse oximeter that's somebody's asking the question, it should come from that list. And if people don't have that, I can send the link to that as well, that's what should be used for cleaning disinfection of medical equipment such as pulse oximeter is going to be moving from home to home.
That's wonderful. Thank you. We'll share that with the participants.
Mm-hmm.
What is the recommendation on how often we should be changing our N95 masks?
Okay, so this is, and this is we're in a time where the use of PPE is, if we think back to a year ago, if you were using, PPE, everything would be discarded, right? N95, you use it once and it's going to be discarded. We saw in the springtime, especially, that we were really in a, we were in what's, CDC's come up with different categories of the use of PPE. So in conventional time, conventional time was a year ago, you used your PPE, your mask, and you disposed of it. Then we had some contingency issues. So we had some shortages. So we have used either there's, reuse or extended use. So in terms of, and then with crisis strategies, and I think people have probably seen what those crisis strategies for masking would be. If there's no masks available, what are the other alternatives? And then they also make sure people know that some of those alternatives are not considered PPE. So back to the question of N95, the recommendation from the Centers for Disease Control is that the N95 should be used no more than 5 times per device. And of course, if you're reusing your masks, if it's soiled, if it's torn, any of those sorts of things, then it should not be reused.
Okay, thank you. A comment from Barbara, and I did forget to mention, video is available in Spanish, Portuguese, Haitian Creole, and that's on the Betsy Lehman website. And she has the link. We'll share that link as well. Eileen, what is the recommendation and how often? Oh, I guess you just said that. That's the same question. Yeah, sorry.
That's okay.
I wasn't reading fast enough. N95 respirators requires fit testing. Given that CPR requires a respirator due to airborne, even if patient's COVID status is unknown, as identified in the Mass DPH memo on July 31st, staff would need to be provided with an N95 should they ever be in a situation to perform CPR. Thus, this will require all staff to be fit tested.
So I think, again, we have some shortages of PPE, and I think when I share the link of what the most recent recommendations from the American Heart Association, they'll provide guidance on what you should do in situations where CPR is required.
Okay, great. So right now, that's the end of the questions. I'm just wondering, while we have Eileen, if someone wants to just add another question, or if you have a comment, we'd like to hear from you. I don't see any other ones yet. We'll just give it a few minutes.
I guess this is Eileen. I had a question for Joanne. Joanne, I'm wondering, can you share some of the feedback regarding the videos, which I think were really, really nicely done. And I think the fact that they're in additional languages is outstanding. And I'm not sure how much use that they, how have they been used already, Barbara?
Joanne,
Thank-
you go first and I'll.
Okay,
I'm
thank
sorry,
you.
I asked everybody everything.
There's a lot that you could put into the video, and there was a lot of discussion about how much is too much and just really sticking with the donning and doffing and making it seem normal. That was the other thing, is to try to normalize something that is now a daily practice for people that has not been and doesn't feel normal at all. So that was sort of what was behind some of the motivation about keeping it very simple, no background, really focusing on the model, and like I said, slow and deliberate actions to take on and put off. My agency has been looking at the video because that was one of my employees that was the model, and people have appreciated that because a lot of people were Googling their own donning and doffing, and boy, there's a lot of them out there, and some of them that we looked at, were like, oh no, there were 10 mistakes in that. So collectively, I think that was just the idea. Let's put something out there that's controlled and hopefully very clear in its instruction.
Right, and I'll just add to that it's up to all of you who have tuned in to really kind of share this with, use it in your training, share it with your aides. It's completely free. It's available sort of on demand online. And I will say, I did look at the at a website, at the analytics last week, just to see what the use had been. It's the English version is actually getting a fair amount, has a fair amount of views, but the Spanish, Portuguese, Haitian Creole ones really aren't. They haven't gained that much traction, and we're going to do some more promotion of that. But I just really want to emphasize that the point of this, and I think Eileen and Joanne and all of you would agree, is that it's a kind of a complicated, manageable, but complicated sort of sequence of steps people have to take. So showing a video to someone once and saying, and feeling like, all right, you've trained, you're trained, you've got this, we never need to revisit this is not the case. So it's just something that I think you really want to encourage people to refer to. The other thing that I'll mention on our website, along where you will find the videos, are also some materials, so printed materials that you can print out. So they're posters and cards, and they're not obviously as detailed as the videos, but they kind of they supplement the videos, and they can be kind of a quick refresher. But I think what we would be encouraging you to do is really reviewing these, using them in your whenever you do training over and over, and in your communications, just send people the appropriate link in the language that is relevant to them, and encourage them to watch it. Oh, and one other thing I'll say is with, obviously producing videos like this is like, you can't just do it every day, and Joanne can attest to that. It's a thing to produce that 8-minute video. You were in the studio for maybe about 10 hours, 8 or 10 hours. It's quite a production, but it's not hard for us to produce more kind of printed materials for you. And so if there's something that would be useful to you that you don't see there, please just get in touch with us, and we will be happy. Our communications and graphic design team, Michelle is part of that, would be more than happy to accommodate those requests. And likewise, this information, this is kind of COVID is a moving target, and so some of the information will change. So if you see information that we're trying to keep it up to date, but if you see something that you feel might not be up to date, let us know. It's easy for us to change it and keep it updated, because that's the goal.
Okay, great. A lot of questions are coming in, and I don't think we'll have time for them all, but we will have Eileen answer them. I think we have time for just a couple more. Eileen, can you just give some clarification on the 5 times or the reuse of the N95 mask? Is this per patient or per day? Or what's the clarification?
Wearing it 5 times. For example, if in one day you were going to 5 different homes, you wore it, then on one day, then discard it. So it's use, donning it for 5 uses, then would discard it.
The next question, are foot coverings and hair coverings needed?
They are not. So they are not part of the recommended PPE recommended by the Centers for Disease Control. It's not necessary to wear them. And again, it would be if your home health agency, if they put that as part of their policy and protocol, then you would adhere to whatever your agency has decided, but they're not necessary. And I think, Joanne might be able to speak to this, is it, I'm not sure why where the foot, the coverings, was that to reassure staff, or were staff worried about those sorts of things, but they are not necessary.
Okay.
I think in home health, where the condition of each household might be very different, cleanliness and regular disinfection, that was offered as an option if you were going into places where cleanliness seemed marginal. As far as hair covering is concerned, we are supporting the use of hair covering, especially if you're going from between patients. And your hair is, you're bending down, you're sort of, doing personal care. Your head is so close to a client that, and if the client's wearing a mask, and even if they sneeze, depending on how they have their mask, whether it's half on or half off, we felt like your hair was, sort of a magnet for whatever, and we just felt more comfortable having a hair covering on our people. But that was an agency policy that we put in place. Again, might differ from what the official guidelines are.
And our purpose in including it was to show where it would fall in the sequence. So if you are using hair or foot coverings, what part of the sequence would you do it in?
Well, it's 11 o'clock. Unfortunately, we ran out of time. There are a lot more questions. As I said, we'll share the question and answers with you after this. But before I say goodbye, I just want to again thank our presenters for volunteering their time. I know they're very busy and it's a challenging time for many of you. We really appreciate your contributions. So thank you very much and be safe.
Thank you. Bye.
Bye.